The broadcast is now starting. All attendees are in listen-only mode.
Hello everybody, and welcome to today's webinar, Cold Laser Research Review 2011. My name is Dr. Rhonda Mostyn. I'm the Director of Clinical Services and Training at Theralaser Incorporated in Toronto. We will begin in just a moment. So, if you have questions during today's webinar, please, you don't have to wait till the end of the webinar to submit the questions. You can submit them at any time. There's a sidebar on the webinar, and you can type in your questions. I will address all the questions, or as many as I can, at the end of the webinar during our question and answer period. So please go ahead and type in those questions at any time. If you are experiencing any technical difficulties at any time, please don't use the chat sidebar to try to reach us. Instead, try our toll-free number 1-866-843-5273, and you'll be directed to someone who can help you out with that. So let's get going with today's webinar. In order to prepare for this webinar, I did many different database reviews to look at what kind of research has been published throughout the past 12 months. From November 2010 to November 2011, so over this 12-month period, when I searched PubMed for low-level laser, any topics related to low-level laser, I found over 450 studies. And this is quite astounding when you consider that from about 1970 till 2002, there were only about 100 positive double-blind clinical studies that could be found on any of these databases. So until 2002, once again over many decades, only 100 of these studies, where in the last 12 months we have over 450 studies. So this is just to say that the research has really been increasing over these years, and there might be many factors contributing to this. Likely, there's a growing popularity of low-level laser therapy, and therefore more interest in finding all the details, all the research details associated with it. Now, when you look at the research areas, there's many of them, ranging from dental, wounds, bone repair, any kind of tissue repair. We're seeing a lot of new medical applications coming out. Some of the research is just based on the technology, and of course nerve repair and inflammation. So there's many different research areas. For today's webinar, I've selected 14 studies, which I'll be reviewing, and of course these will just be a sampling of what's out there. There's many, many more studies, but I've just kind of selected some studies that I think are interesting, good studies, and we'll be reviewing those in a moment. Now, whenever we do look at these studies, it's important to look at them with a very critical eye. You need to know what to look at in any study. But when you're looking at a laser study, some of the key things you have to look at are the laser parameters. So what power, time, dose are they using in these studies? There's all kinds of different wavelengths being used, different power settings, all kinds of different protocols being used in these studies. And it's important to really understand those, because one protocol may not work and might end up with a negative study, whereas a very different protocol might have created a positive study in that case. The other area to look at is the treatment program, the number of treatments, how often is the patient or animal being treated, and of course the study design. We really want to look at double-blind, randomized, placebo-controlled trials. They're really the gold standard these days, and the studies that I'm seeing out there with low-level laser therapy are all pretty much now these double-blind randomized trials. Back before 2002, there were all kinds of studies out there. They weren't all good. But now we're really seeing as a standard, they're very good controlled trials. We also want to see that there's a large number or a significant number of subjects involved in these studies, so we know that they're looking at a good subject size. So these are all things we need to look at closely, and I'll be pointing out some of these factors when we're looking more specifically at the 14 studies coming up. Now, one thing that I think is very interesting to look at is that there's positive studies and negative studies. Of course, there's lots and lots of positive studies, and today I'll be focused on the positive studies. However, when you do look at a negative study, it's very important to look at this critically, because a negative study is, of course, very, very useful to us as well. A negative study does not mean that laser does not work at all. It might just be ruling out the specific parameters that are used in that study. So even for a negative study, we need to look at the parameters used and learn from those. So let's look at the Theralase parameters, just so you have a means of something to compare these other studies to. The Theralase lasers use two wavelengths of light, a near-infrared and a visible red. The near-infrared laser is a 905 nanometer super pulse laser with a peak power of 50 watts, which is the same thing as 50,000 milliwatts. The average power ranges between 0 and 100 milliwatts. Frequency is 0 to 10,000 hertz. The red laser, so once again we always use the two lasers, the near-infrared and the red. The red is a 660 nanometer laser with an average power of 25 milliwatts. So if you want to compare the wavelengths and power settings used in these studies compared to Theralase, here you go with our parameters right in front of you here. So let's get going with our first study. I'm going to start with a couple studies on nerve repair. I think this is a very important area because we know that laser is very effective on healing different neuropathies, different nerve pain, nerve damage, but there's still a lot of research to be done to show why does this work. There are some leading theories, but we still need a lot of research in this area. We know the end result, it does work, but why? So in this first study, what they did is they looked at the histological analysis of laser therapy effects in peripheral nerve regeneration in rats. This was, of course, a 2011 study, as most of them I'm presenting today are. This was out of Brazil. And what they did here is they took a total of 20 Wistar rats, which are typically the rats they'll use in these kinds of studies, and they took the sciatic nerves of these rats and they put them through a crush injury. So a crush injury means they don't totally damage the nerve. It's not severed, but it is injured in such a way that there's degeneration of the axon beyond that injury site or distal to the injury site. So these 20 animals were actually randomly distributed to two groups, a control group and a laser group. So of course the control group did not receive treatment and the laser group did receive treatment. And then beyond that, what they did is split them further into two groups. Each of these groups were euthanized at different times. From the control group on day 14, half of them were euthanized. On day 21, half of them were euthanized. And in the laser group also, half of them were euthanized at day 14 and half euthanized at day 21. So in this way, they could look at what was happening in that nerve, what kind of repair was being processed at day 14, and a little longer follow-up at day 21. Now, what kind of laser were they using? We have to always look at this. It's very important. They were using a gallium arsenide 904 nanometer pulse laser, so not necessarily a super pulsed. Often when they say pulsed, it's not necessarily super pulsed, but it is pulsed. 26 milliwatts. They said transcutaneous, so they're treating right over the skin. They've the rat has incurred the damage to the sciatic nerve. Then they sew up the rat and then they treat over the skin. They obviously shave the fur off in the area, and these are the spots they were treating, 3 points on either side of the damaged area. They're treating for only 32 seconds. We have to keep in mind this is a rat, so not the size of a human. Obviously they will not take the same dose as a human. So laser therapy was initiated on the first day after surgery and then daily until either 14 days or 21 days, depending on when that rat was euthanized. So on the 14th day, the first 10 animals were killed and the sciatic nerve was removed, and they examined to see in the control group and the laser group at 14 days what was the status of that nerve. And then the same procedure was performed on the 21st day after treatment. Once again, they looked at a control group and the laser group after 21 days. So at the end of these treatment, they removed part of that nerve again, and what they looked at in this study are the number of Schwann cells, the number of myelinic axons with a large diameter, so good quality axons, and the number of neurons. These are what they were looking at to evaluate the change or the repair of these damaged nerves. What they found was that in the groups that had low intensity laser therapy, there was an increase in the number of all these things. They had more Schwann cells, they had more large diameter axons, and an increased number of neurons compared to the control groups. So this is one of the hypotheses for how laser affects nerve repair, what it can achieve when you stimulate a damaged nerve. In this study, these were their findings. So irradiation with a 904 nanometer laser with the parameters used in this study positively influenced the regeneration of the sciatic nerve in the study with more rapid and efficient nerve recovery than if they had just used the control group. Here's another nerve repair study. This study was a little bit different. What they wanted to see in this study was what would be the difference if we started treatment right after we injure the nerve, or if we delay it a little bit and start our laser after a number of days. So they're looking at completely different things in this study. They're looking at their goals are a little bit different than in that last study. Once again from 2011, and this study was also out of Brazil. So once again, they subjected these poor rats to a crush injury. They used low-level laser therapy, a gallium arsenide laser applied right over the skin. So they shaved the rat and applied this directly over the skin at the injury site. In this case, they used 3 minutes, so much longer treatments. So very different parameters once again, with a frequency of 5 treatments per week for 2 weeks. So this was 10 treatments in this study. They had split the group into an early group and a delayed group. So in the early group, they started the laser treatment right after the surgery, and in the delayed group, they waited 7 days before they started the laser treatment. Now, how do they test for the recovery of the nerve? There's different ways to test. One is something called a grasping test, where they're really looking at the muscle or motor recovery. Once the nerve is repaired, of course, the animal will have better motor function again, so it's called a grasping test. They perform this test before the surgery, 10 and 21 days after the surgeries. And then they took the nerve out and had a closer look. In this case, they looked at the myelinated fiber and axon diameters, similar to in the last study. They looked at the myelin sheath area, so how good was the quality of this myelin sheath, the number of myelinated fibers, and in this case, they also looked at the number of capillaries. So we know with laser therapy, we can increase the blood flow, increase the new vascularization of an area, and of course, this will help with the nerve regrowth. So these are the factors they looked at. And what the results were, from the histomorphological results, they found that in the proximal segment, so where they cause the damage to the nerve, the early and delayed treatment both showed myelinated fiber diameter and myelin sheath area significantly larger than the untreated group. So very good results at the site of the crush. And then in the distal area, so a little further from the site of the injury, the myelin sheath was also significantly larger in the delayed group this time. So the delayed group did a little bit better in this time, waiting to do the treatment until 7 days. Functionally, so that motor capabilities that they tested, the grasping test, the untreated early and delayed groups all did start recovery. However, there was a much higher degree of functional recovery with the laser-treated group. So there's a significant difference. So ultimately, both histomorphologically and functionally, the laser-treated group did much better in all these areas, with the delayed group doing better in a few aspects. So the results suggest that nerves irradiated with low-power laser exhibit myelinated fibers of greater diameter and a better recovery of function. Let's look a little bit closer at pain. I pulled up a study on pain in this next study. It's called Inhibitory Effects of Visible 650 nanometer and Infrared 808 nanometer Laser Irradiation on Somatosensory and Muscle Action Potentials in the Rat Sciatic Nerve. So once again, they're going to look at the sciatic nerve, but in this case, they're going to compare the effects of 650 nanometer, which is a red light, and infrared 808 nanometer. Do these both have different effects on the recovery of nerve? This is an important thing to look at. We always have to look at different wavelengths of light, see their effects on tissue repair, because they can have different effects. So we know that laser therapy has been shown to relieve chronic pain, but once again we have to really start evaluating the reasons why. We're not really sure why it affects pain. Once again, there's many theories out there, but we really need to start looking at specifically how does this work. In this case, they assess the effects of laser on something called somatosensory evoked potentials, or SSEPs, and muscle action potentials, or CMAPs, in a series of experimenting using both the 650, which is a red light, or the infrared 808 nanometer, applied right over the skin transcutaneously to points overlying the sciatic nerve on rats. And this is what they found in summary. The 650 nanometer laser therapy decreased the sensory amplitude and also the muscle amplitude. It had an effect on both of these. So it had a positive effect. And similarly, the 808 nanometer also decreased both these amplitudes. So basically decreased those pain thresholds. With both the red light or the infrared light, both worked during this study. So these results actually strengthen the hypothesis that there is a neural mechanism underlying the effectiveness of laser therapy for pain. Once again, there's all kinds of theories on how laser works for pain, but a strong hypothesis is that the laser actually affects the pain signal at the source of the pain, which is the nerve itself. It has an effect straight on the nerve and therefore reduces the pain that's coming from the nerve itself. I have a few studies coming up here that all look at the skeletal muscle repair. Now we know that laser, one of its key uses when we're looking at any kind of tissue repair is skeletal muscle repair. The laser can repair all kinds of tissue, whether it be bone or muscle, nerves, but in this case we're going to look at the skeletal muscle repair through 3 studies. Now once again, I'm only pulling 14 studies out. I said there's over 450 studies that I found just in the last 12 months. So I hope that after the webinar, you'll do your own searches and really see what else is out there. This is really just a sampling of what you might find. And also just a review of what to look for in these studies. So this first one's called Phototherapy with Low-Level Laser Affects the Remodeling of Types 1 and 3 Collagen in Skeletal Muscle Repair. This study, once again, is from 2011, and the purpose of the article was to analyze the role of low-level laser therapy on skeletal muscle remodeling following injury in rats, and they're looking at the change or the production of collagen proteins after the rats are treated with laser. So once again, they take their Wistar rats, 50 rats, that's a very good sample size, and they split them into groups, and the groups consist of control, a sham group, an injured group, and a laser-treated injured group. Here they treated their rats 3 times a week on the injured region using an indium gallium aluminum phosphorus laser, 660 nanometers. They're using red light here with 20 milliwatts. That's a pretty good dose of power considering these are rats, so small animals, with only 10-second exposure time, so very fast treatments. Their total energy dose was 0.2 joules. And then, of course, what they do is they kill the animals and they have a look at these at the muscle to see what is happening in the muscle, what's happening with the muscle repair. They looked at animals after day 1, day 7, and also day 14 and day 21. So they really want to see what happens with the muscle after treated with laser in the short term and also in the long term. Here, long term is considered day 14 and day 21. So the muscles were processed, stained, and then analyzed. What they found, the key here, what they found, is that after 7 days, that's really when they were starting to see differences between the laser-treated group and the non-laser-treated group. At 7 days, what they saw was that there was a reduction of myonecrosis, or kind of muscle dying off because of low blood supply. And that's because the laser at this point was really stimulating new vessel growth, or angiogenesis. And this angiogenesis was helping to nourish the muscles. And because of this, they saw a stimulation of type 1 and 3 collagen on day 7, a significant increase in these types of collagen. So that's one of the ways laser will help repair skeletal muscle. It'll help form new blood vessels and help to create the collagen needed to build up that skeletal muscle again. So this is not just a theory, but we're actually seeing this in the studies, an actual physical repair of the muscles. So their conclusion was that this type of diode laser, an indium gallium aluminum phosphorus laser, with these power parameters seen in the study and the conditions they use, had a stimulatory effect on the regeneration phases of the skeletal muscle by promoting angiogenesis, reducing myonecrosis, and inducing type 1 and 3 collagen synthesis after a cryo injury in rat. This next study that also looked at skeletal muscle repair looked at something completely different, which was what will be the effects on something called COX-1 and COX-2. So what happens if you have tissue injury? You have, whenever you injure a tissue, you have arachidonic acid being formed. And this arachidonic acid will then create other kinds of proteins and inflammatory products via an enzyme called a cyclooxygenase enzyme. This is also called COX-1 or COX-2 enzyme. Now, COX-2 really gets greatly increased in inflammatory processes. And when you look at medications like your NSAIDs, NSAIDs are often COX-2 inhibitors. They'll try to decrease the COX-2 and bring down that inflammation. COX-1 is actually usually something not too bad to have around, although it can be involved. Let's just stick with our COX-2 once again. This can be greatly increased in inflammation. COX-1, not so bad to have around because it does have some positive effects with platelet function, macrophage differentiation. So they're different. We're really focused on our COX-2 here. So we want to see in this study how different doses of laser affect the expression of COX-1 and COX-2 after skeletal muscle injury. So once again, they took their 30 rats. Here's looking at a picture of a rat where they're actually stimulating the muscle here in the rat. Take their 30 rats and divide them into groups that either receive laser or no laser. But within the laser group, they all receive different doses. A lower dose anywhere from 0.1, 0.3, 1 joule, all the way up to 3 joules. So 3 joule was our highest dose of laser. The laser used was a 904 nanometer laser, so that's a near infrared laser, using 15 milliwatt average power. So a pretty good dose for a rat. And this was done before contraction in the muscle was induced for the treated groups. So what they do then is they irradiate these rats and then they stimulate the muscles to kind of fatigue out the muscles. They gave them 6 tetanic tibial anterior muscle contractions that are stimulated by a device. And right after the final contraction or the 6th contraction, they took blood samples to evaluate the CK or creatine kinase activity, which is something we see in kind of injured or overused muscles. We see a lot of CK produced. And then they dissected the muscles to evaluate them for COX-1 and COX-2. And what they found was in the laser-treated groups that had kind of higher amounts or higher doses, the 1 and 3 joule groups, had a significant enhancement in their total work performed. The muscles worked very well during those 6 contractions compared with the control group. And all the laser groups, except for the highest dose, presented a lower post-exercise CK or creatine kinase activity than the control group. And we do want that. If we have a very high CK level, it'll take longer for that muscle to repair itself. Also, what we saw with the 1 joule group, they had an increased COX-1, which is good. We want that, and a decreased COX-2, which is what we want as well. We want to decrease our COX-2 and bring down the inflammation after tissue damage compared with the control group. So overall what they saw is they found a dose that they thought worked the best, which was 1 joule work the best to enhance skeletal muscle performance and to decrease post-exercise skeletal muscle damage and inflammation. So once again, they're looking at very specific parameters here. They could have trialed this out with different parameters. They're only testing these. It doesn't mean that these are the only ones that will work. However, in this case, the one dual was the best to have these effects. But I think what's more important here is to look at the actual effect, was that the muscle performed better, that the post-exercise muscle damage was decreased, and the level of inflammation was decreased. So this is very important to note, what are the effects of the laser on the skeletal muscle, and how can that help ultimately, our patients or humans. Here we're just looking at rats, but we really will have similar effects on humans using different doses. Okay, this is our last skeletal muscle repair study, and here what they're looking at is the effect of low-level laser therapy on the expression of tumor necrosis factor alpha and beta. So what these are, tumor necrosis factor alpha and transforming growth factor beta. So tumor necrosis factor alpha is a cytokine. It's something that is released during inflammation, and if you have it released constantly, you're going to have a chronic inflammatory situation. So generally what we want to do is bring down our tumor necrosis factor. Our transforming growth factor is a protein that controls proliferation, cell differentiation. But when it comes to tissue damage, if you have too much transforming growth factor, it can lead to an increase in scar tissue or fibrotic tissue growth. So ultimately, when we're healing skeletal muscle, we want to have a decrease in our tumor necrosis factor and a decrease in our transforming growth factor so that we don't have chronic inflammation and we don't have too much scar tissue forming. So once again, they're looking at both these, the effects of laser therapy on both of these factors. So once again, without getting into too much of this, because it is the same approach, they used 35 rats, divided them into control groups and laser groups, and they treated injured skeletal muscle areas with aluminum gallium phosphorus laser at 660 nanometer. That's a red light, 20 milliwatts, so similar to the last study. An energy density of 5 joules per centimeter squared. That's a good dose. Exposure time just 10 seconds, so very fast treatments. And then they looked at the muscle repair at 1, 7, and 14 days following the injury. And then they removed the muscle and look at them, and then they evaluated the tumor necrosis factor and the transforming growth factor as well. And what they found was that laser therapy showed, the laser treated group showed a decrease in both of these factors, which is really what we want, so that we can bring down the inflammation as quickly as possible so that the muscle can repair properly, you don't have a chronic inflammatory situation. And it also brought down the amounts of the transforming growth factors so that we don't end up with a lot of scar tissue. So this is something we already know about using laser. We can bring the inflammation down quicker. We can repair tissues in a healthier manner so that we're not left with skeletal muscle full of scar tissue, which creates another chronic problem. This study just really supports what we are already seeing in practice. So it's a good study to kind of back up that information. This next study we're going to look at a shoulder injury. I'm sure many of you, if you're using laser, have been treating shoulder injuries. It does work very well. And if you're working in a practice where you're seeing a lot of musculoskeletal injuries, you probably see a lot of shoulder injuries. They're very popular. So in this one, they looked at the additive effects of laser therapy with exercise on subacromial syndrome. It was a randomized double-blind controlled trial from 2011 out of Iran. So here what they're going to do is compare laser therapy plus exercise compared to exercise alone. Will the laser therapy speed up this healing process? This was a very good study in that they used 80 patients. So here they're not using rats, they're using real life patients, and 80 of them, which is a very, very decent sample size. They were able to have all these patients come in because this study was done out of a clinic, or an outpatient clinic. And the patients were randomly allocated into two different groups, our laser group and our placebo or sham laser group. So our laser group were treated with a pulsed infrared laser, so that's an invisible light, not a red light, an infrared laser, plus exercise for 10 sessions during a period of 2 weeks. Now, whenever I see studies that are treating patients or humans, I always look for at least 10 sessions. That seems to be kind of a standard in research that I've seen, at least present-day research looking at laser therapy. They usually do at least 10 to 12 sessions before they evaluate the patients. And that's a very fair dose of laser. That should, you should be seeing some results after that time. Group 2 had a sham laser, so placebo laser, and also the same exercise therapy for those 10 sessions over 2 weeks. The evaluation methods were a visual analog scale, so a pain scale, and they also looked at shoulder range of motion in active and passive, different active and passive motions or movements. In both groups, they did see improvements. However, when you compared their groups, there was a much more significant improvement in all the movements in the laser-treated group. So what we're really looking at here is how can we enhance or speed up the healing in patients. In this study, it does show that exercise helps, a natural course, the patient might heal, but laser therapy combined with exercise was more effective than exercise alone in relieving pain and improving shoulder range of motion in patients with subacromial syndrome. So it definitely will speed up the process of healing for many conditions, but in this case we looked at subacromial shoulder syndrome. We often get the question about using laser in conjunction with other modalities or other treatments, and I haven't actually seen a lot of studies in this area. I've seen some studies that compare the use of laser compared to ultrasound, laser compared to exercise alone, but we don't see a lot where you're using laser plus another modality compared to some different kind of controls group. This was interesting. They looked at using chiropractic manipulation and low-level laser therapy in the management of cervical facet dysfunction. So what they did is they compared manipulation plus laser therapy compared to just having manipulation on its own. Was there any benefit to adding the low-level laser therapy into this chiropractic treatment? So if you are a chiropractor in the audience, this should have a lot of significance to you to see how you can speed up healing for your patients when they come in with cervical facet syndrome. In this case, once again, they took a very big sample size, 60 women ages 18 to 40 with cervical facet pain of more than 30 days, so it was not an acute injury. They've had it for a little while. They had normal neurological examinations, and this group of 60 were randomized into 3 groups. The first one had only manipulation, the second group had laser therapy only, and the third group had a combination of manipulation and laser therapy. In this case, they only received 6 treatments. I would say that's a little bit low. Typically, as I mentioned, in most of these studies, you're looking at 10 to 12 treatments. And this was over a 3-week period, so two treatments a week. They used several outcome measures. They used a pain rating scale, which is the visual analog scale, a neck disability index, range of motion, an inclinometer, and they took these measurements at baseline, so before treatment, and then also at week 2, 3, and 4. At baseline, there were no differences between these groups. But then what we start seeing is a significant difference between the groups. Ultimately, what they're finding here was a combination of CMT, or manipulative therapy, and laser therapy was more effective than either of these two things on their own. So that's very interesting. If you're going to be doing manipulation and you have a laser, why not combine these two and really give your patient what works best and what will heal them fastest? So sometimes a combination of these therapies is even better than using one of these on their own. And that'll really come into play in a lot of your practices where you have different modalities that you can use. Okay, so moving along, Once again, I just want to remind you, if you have any questions, please do submit them at any time. Keep them coming in. I'll get to them at the very end. When we wrap up, I will send you off, I will answer the questions for the group. So I have a couple studies here on wounds. We do get a lot of questions about wounds because laser for wound repair has been around for many years. In fact, many of the early studies, or a lot of the original studies, were really focused on wounds, and we still see a lot of studies coming out with wounds because they're very difficult to treat, especially when you have a long-standing chronic wound. If you've ever seen this diabetic wound, they're very persistent, very difficult, and these patients are really suffering, but we've seen a lot of great results using laser therapy to speed up that healing. This first study looked at the effect of low-level laser therapy on chronic diabetic foot wound healing. So this was a preliminary report out of Iran. The study was done in 2011. So in this case, they took 23 patients, so a fair size. It would be nice to see this study size a little bit bigger. They'd had the diabetic foot wounds for at least 3 months, so quite a while at this point, although I have to say we do often see these patients suffering from these wounds for years. Patients were randomized to receive either a placebo treatment or laser therapy, and the laser used in this case was a 685 nanometer, or a red light, with an energy density of 10 joules per centimeter squared. They also did have conventional therapy as well. Conventional therapy is usually dressing of the wound, could be debridement, antibiotics. Usually the wound care is not done in isolation, it's done in a team, with low-level laser therapy being part of the protocol. These patients were followed for 20 weeks. This is really important to look at. When we're dealing with wounds, we're not usually looking at 3 or 10 treatments. This could be a really long treatment protocol, but when we start seeing results, we keep going with it because it means it is working for them. So these patients were treated 20 weeks, and what they compared at the end of the 20 weeks were the ulcer size, how much it had reduced, and also the number of patients who actually had complete healing. So this is not actually from the study, but this is kind of a typical diabetic wound here, this picture. So they can be much deeper than this, much, much deeper. They can go all the way down to the bone, but here is a diabetic wound. What they found that by week 4, the size of the ulcers had decreased significantly in the laser-treated group, so compared to the control group. By 20 weeks in the laser-treated group, 8 of the patients had complete healing, and in the placebo group there were only 3 patients with complete wound healing. The time for complete healing in the laser-treated groups was 11 weeks, the average time. In the placebo-treated groups, it took about 14 weeks for that complete healing. So this was very interesting because the laser group really did have a speedier healing, and more of them had complete healing. So in conclusion, this study provided evidence that laser therapy will accelerate the healing process of chronic diabetic foot ulcers, and also that laser therapy will shorten the time period needed to achieve complete healing. This is very good news for people suffering from diabetic ulcers, really having to suffer from this for years. This will speed up healing for them. This second one I'm not going to spend too much time on, but I just wanted to present this to you as well, a second wound healing article or study. In this study, they used a gallium arsenide, a 904 nanometer, which is near-infrared nanometer laser, and they compared this to using a HENI, or a helium neon laser, which was a red laser. It's a much lower-powered device. So they wanted to compare what was the difference between using a high-powered, high-wavelength laser to a lower-powered red light laser to heal a full-thickness skin wound. And once again, here they used rats. And without getting into too much detail here, just what I really want to point out here is that at the end of the day, they found the gallium arsenide laser to be more effective on wound closure and on returning the injury to the normal level than the HENI laser. It's very important to look at the lasers being used. There are a lot of studies out there with HENI laser. And when you're looking at these, you have to keep in mind these are lower-powered laser. For a lot of these injuries, you will really need a more powerful laser with a higher wavelength. such as the indium gallium arsenide laser, closer to the 900 nanometer range. So look at the laser they're using, look at the wavelength they're using, and take this into consideration when you're looking at the results of the study. In this case, they found really good positive results in healing wounds using the infrared light, the 905 nanometer light. So I want to present some medical studies that are out there right now. There's lots of different medical studies out there right now, and they're really just the tip of the iceberg in where laser is going. It doesn't mean that we can actually use laser for these different medical conditions in the present moment. Really, I'm just presenting these to show you that the research is starting, that these are things that down the road, perhaps, we'll really see the laser being used for. So please keep that in mind. These are really preliminary studies, but they're promising. This first one's very interesting. They looked at the effect of low-level laser light on sperm motion characteristics and DNA damage. So we know that infertility is a big problem these days, and sometimes the issue is the sperm motion, number of sperm. So researchers are interested in finding ways to enhance this. So in this case, they took 33 samples, semen samples, and they were classified as normal sperm, low concentration, and also poor motility samples. And then they divided them into treated and control groups. Treated samples were only exposed to 30 seconds of infrared laser, 905 nanometer laser, so that's your near infrared or invisible light laser. It was a pulse laser. And then the samples were incubated and analyzed at 30 minutes and then 2 hours. So they only followed them for 2 hours. And they analyzed the semen. And what they found very interesting was that there was a significant increase in the sperm motility, especially with the samples that had a low sperm count or low motility. So the samples that really needed these changes had a significant increase due to the laser treatment. They saw this after 30 minutes of treatment. They're also always worried about damaging the sperm, and they want to make sure that the laser is not going to cause any DNA damage, and the good news is that it didn't, that the samples were kept intact without damage. So in conclusion, the low-level laser light exposure had a positive short-term effect on the motility of these treated spermatozoa and did not cause any increase in DNA damage measured at the 2 hours. So this is a promising area of research and quite exciting. This next area is tinnitus. So I classified this under medical. We see this in all kinds of practices. I've treated it here in our Theralaze clinic with quite good results, and I've spoken to customers and patients who have been treated with laser for tinnitus with very promising results. And there's quite a few studies out there. In this case, they used a 650 nanometer 5 milliwatt laser, and the patients were treated for 20 days and 20 minutes a day. Now, 20 minutes a day is a lot. And the reason I think they needed so much time is that this laser is a little lower powered. They only use 650 nanometer. It's a lower wavelength with only a 5 milliwatt dose. So the dose is pretty low, and because of this, they probably went with a higher time. If you're using a higher powered laser, there really would be no need to sit there for 20 minutes per day. They measured the sensation of tinnitus on a visual analog scale before and after 2 weeks of treatment. And what they found was the visual analog scale difference before and after treatment was statistically significantly different. The laser-treated group did much, much better. They looked at different factors, for example, age of the patients, and they found that the younger group did better than the older group in terms of the laser treatment. So that was a very interesting factor. I've never seen this looked at before. So this doesn't mean it'll always be this way, but in this subject group, the younger group did a little bit better. They didn't find any real difference between male and female patients. However, they also took into consideration the noise level in the patients' workplaces, and they found that in women, it didn't really make a difference, but in men, it did have an impact. The men with the higher noise level in their workplaces who were treated didn't do as well with the men who were coming from a quieter workplace. So in conclusion, low-level laser irradiation was effective for treatment of tinnitus, and there were some variables like age and job that can affect the treatment outcome. This was very interesting to me. to really know, to ask these questions about job and environment, and to take into account the age of the patient when treating patients for tinnitus. This next one is looking at the effect of low-level laser therapy on salivary glands in patients with dry mouth syndrome or xerostomia. Now, generally, whenever we're training customers or we're talking about laser treatments, we say stay away from glands because we're a stimulating device and you will stimulate the glands, and who knows what will happen because they produce different glands produce different hormones or different proteins. In this case, the salivary glands obviously produce saliva, which we want. So even though we tell you this, there is research now on how laser can help out in certain circumstances where the glands are underproducing. Now, of course, we still can't really advise you to use the laser for these areas because it really has to be done under a controlled environment where they're testing the levels, where we're testing, for example, if it was thyroid, we'd have to test the thyroid hormone level. So it has to be controlled. But the research is starting, and I really can see that down the road we will be using laser to stimulate understimulated or underproducing glands in patients. In this case, they're looking at dry mouth syndrome. They looked at 34 patients. The method was using a laser light from a pulsed 904 nanometer, so once again a near-infrared light, gallium arsenide laser. They applied this on both sides, bilaterally, on each salivary gland. So they came in from extraorally on the parotid gland, so from the outside of the skin, and then they use a laser actually inside, intraorally, on the sublingual gland area, which is down through here. It was a fairly short exposure time, 120 seconds, so 2 minutes, daily treatment for 10 consecutive days. So once again, that's kind of the standard 10 days. They used 29.5 joules per centimeter squared. And the control group did not obviously receive laser. They were just given a solution to rinse their mouth out to help their mouth from getting too dry. And what they really found here was in the laser group, there was a much greater increase of salivation. And the interesting thing is with every day they treated these patients, the patients had a progressively increased amount of salivation. The control group did also have initially an increased amount of salivation, but then it would go kind of up and down. It wasn't a linear increase. It was kind of an unpredictable thing. So the researchers here were quite excited about this because they saw from this that low-level laser therapy can have a positive effect on salivary glands, not only by stimulating the glands, but also perhaps are regenerating that gland so that they can kind of start working on their own a little bit. And that using that laser over a period of days had a slowly linear increase in that amount of saliva production. It wasn't an up and down, it was just a slow increase, which is what they want to see. They want to heal these patients. I'm going to end with this last study, and this one's on post-mastectomy lymphedema with laser therapy. So this is just a single study on treating lymphedema with laser therapy. I want to let you know there have been several studies. I saw several studies in 2010, and it is a growing area of research and a promising area of research. We're really seeing some good results in this area, treating with laser. And we know that this post-mastectomy lymphedema, this condition affects many, many women out there. So I think what we're going to see more and more in the future is laser being used as a primary tool to help with this. So this was a double-blind control randomized study out of Egypt. This was published in 2010. So in post-mastectomy patients, lymphedema can become a progressive, permanent condition and is very resistant to treatment. It's a difficult condition to treat. In this study, what the researchers looked at to evaluate the effects of laser was limb volume, how mobile their shoulders were, and hand grip strength. These are all factors that are typically affected when the patient is suffering from lymphedema. So they looked at 50 women, that's a very good sample size, with breast cancer-related lymphedema. This was a double-blind, random controlled trial, and the group was split into a laser group and a placebo group. They were treated with a gallium arsenide laser with a wavelength of 904 nanometer, So we're seeing a lot of research out there right now with 904 or 905 near-infrared laser, which is we use with Theralase. It's a very powerful, deeply penetrating wavelength of light. In this case, they used 5 milliwatts, and they treated right over the axillary area and the arm area. So you're not just treating one spot, you're kind of following down from the axilla, follow down the swollen areas, and you can even just kind of treat along the lymph nodes. These patients were treated 3 times a week for 12 weeks, so a good treatment regimen. The placebo group, of course, received a sham laser, the laser that was turned off basically, but they think they're receiving laser treatment. And then the limb circumference, shoulder mobility, and grip strength were all measured before treatment at 4, 8, and 12 weeks. So they did follow these patients for quite a while. Now, at baseline, these groups, all the women had similar factors. They had similar limb circumference, mobility, and grip strength. And what they saw overall was that in both groups, there was a reduction of limb volume in both groups. However, there was a much more significant reduction in limb volume in the laser-treated groups, particularly by week 8 and week 12. So it didn't happen right away. It really takes some time and some treatments. And even when they finished working with the patients, what we'll see is the effects of the laser should continue during follow-up treatments. And the data for shoulder mobility and hand grip strength were also statistically significantly better for the laser-treated group than the placebo. So their conclusions were laser treatment was found to be effective in reducing the limb volume, an increase in shoulder mobility, and hand grip strength in approximately 93% of patients with post-mastectomy lymphedema. That is a very significant number and very, very promising results. So we've gone over quite a few studies here, ranging from tissue repair, medical conditions, nerve damage, and pain. And once again, this is just to kind of show you the type of research that is being done out there. Very good quality studies looking at different wavelengths, different treatment paradigms. But overall, we can find really a greatly increasing number of positive good studies, meaning the placebo double-blind controlled trials with laser therapy. If you want to do a search on your own, a good place to start is PubMed, P-U-B-M-E-D. You can also try the Theralase website. We also, we consistently post new research. And if you go up on our website, www.theralase.com, you'll find recent studies, several of which I have not covered today. So please always look back there. And if you ever want a specific study, we keep a huge database here at Theralase on all the studies out there for many, many different conditions using laser therapy. So please, at this point, I really invite you to submit your questions. I'll get to them in a couple minutes or a couple seconds. In the meantime, I want to let you know about a couple upcoming events. On Saturday, November 26th, we'll be running a 6-hour CE seminars co-sponsored by the Canadian Memorial Chiropractic College in Toronto. The seminar will focus on the clinical applications and theory of low-level laser therapy. When I say it's a CE seminar, it does qualify for CE credits pretty much through Canada, but certainly in Ontario. On Tuesday, December 6th, we're going to be holding a cold laser introductory workshop at our Theralase Centre in Toronto. This workshop is geared toward health practitioners who are interested in laser and don't necessarily use laser at this time, but just wanted to have some hands-on experience using laser. It'll be a combination of a presentation and a hands-on workshop. Once again, that's geared toward people interested in learning more about laser who don't currently use a laser. And to register for these events, you can visit our website or call the toll-free number 1-866-843-5273. So I'm going to get to your questions in just a moment. Okay, well, the first question is one I always do get, which is, can we get a copy of the slides? If you have attended the webinar, what you'll get right following the webinar is a email that will ask you to answer a few questions. And when you submit in those questions, we will automatically send you out a PDF copy of this webinar. So of course we would be happy to help you out that way. Okay, there are a lot of questions. Please just bear with me. Okay, another question, is this archived for review in the future? We tape all of our webinars, so we record them all, and then we post them to our website. It is a customer-only section, so if you're a Theralase customer, you will have a login and password, your own login password, and that will allow you access to all of our pre-recorded webinars. Okay, I have a question here about the wound treatment. You know, today I didn't really get into the specific treatment, like, for example, the way we would train you on treating. I really just wanted to put out there the information being looked at in various studies. However, I will get to this, which is when you're treating a wound on the foot, do you treat directly over the wound? If it's an open wound, we don't actually contact that area. If it's an open wound without a bandage, we just hover ever so slightly above the wound, and we do unfortunately lose a little bit of the light that way, but it's we can't contact the wound direct. With most wounds, though, they are covered with a bandage, and as long as it's a clear, transparent, sterile bandage, we can contact that directly. So either you directly contact the clear, transparent bandage, or you hover ever so slightly above the wound site. Okay, so the next question is, do I have any studies on bone repair? And if so, can you treat over a metal implant? We have many studies on bone repair. It's a very popular and positive application for laser therapy. We treat fractures all the time, and a lot of our practitioners are treating that. We don't worry about metal implants. Please keep in mind that we're using cold laser therapy. We do not produce heat, so treating over a metal implant, we don't worry about heating up that device. Of course, you need to be aware of the implant so that you need to kind of treat around the area, making sure you're working the whole area, because the laser won't go through the implant, but it is not a contraindication. Once again, please be patient. I have a lot of questions here. I'm just quickly going through these. Okay, can you use ultrasound TENS IFC in conjunction with the Theralase laser? I did, try to make a point of that during this webinar to say that we are using the laser sometimes in conjunction with other modalities. It's definitely also a standalone device. At Theralase, we run a laser clinic where we're in almost all cases just using lasers, so we know it's very effective on its own. However, we do have a lot of customers who are using it in conjunction with other modalities. The only thing we warn you to be careful about is using it in conjunction with ice. Ice is a vasoconstrictor, and the laser tends to cause temporary vasodilation, so we don't want to interfere too much. If you're going to ice, we ask you don't do it just before or just after the laser. The patient may want to ice at night or on their off days. But in terms of ultrasound TENS IFC, you can use it in conjunction with the laser. Is cancer still an absolute contraindication? So we say it is an absolute contraindication, and it becomes kind of a little bit of a gray zone when we're looking at research for the post-mastectomy lymphedema. I've seen some studies out there where they're starting to specifically look at the effect of laser on breast cancer cells, and there were some positive results in that the laser really had no effect on breast cancer cells. However, as you know, there's many different cancer cell lines. We do know that some cancer cell lines, the laser could increase the cancer cell growth rate. Breast cancer, like I said, we're starting to see studies that say we don't negatively affect the cancer. But I think we need to see a lot more of those studies to really feel confident. So at the bottom line up there, we do recommend to wait till the patients are 5 years cancer-free. Okay. This next question is, if someone has a chronic condition and laser reduces their pain, can they use it every day for a long period of time? Generally, what we recommend is to use it for a period of time and then take a break. We don't want you to be using it every day indefinitely. The longest we really treat is about 20 treatments, maybe 25, and then we would suggest taking at least 2 weeks off, so to kind of give the patient a washout period without the laser, and then they can start again for a series of treatments. So we don't say to use the laser consistently for months and months on end. Have the patient take a break. Okay, let me try to get to a couple more. Is the November 26th seminar an online webinar? It is not. When we use the word, I know that might be a little confusing. The seminar is actually being held at the college, the Chiropractic College in Toronto, so you do need to be present for that. And actually registration for that seminar is being handled through CMCC. You go to their website or contact the postgrad department. Alternatively, you can contact me at rmostyn@theralays.com, rmostyn@theralays.com, and I can send you off a registration form. Can you treat through light clothing? We do not treat through any clothing with laser, except for that situation of open wounds. We treat directly on the skin. Even in these studies, when you looked at the rat studies, they were treating transcutaneously with direct contact. As soon as you lift that laser off the skin, you lose a lot of that laser light, and it's just not as effective. To really gain the benefits of laser and to try to get that light deep into the tissues, we need skin contact. Okay, I apologize to any of you who have unanswered questions. We have so many questions coming in. I won't be able to get to them all direct today. I will get back to you via your private email for any of you who did not have your questions answered. I do thank all of you for your time today and for attending this webinar. We run webinars every month, and I hope that you will join us for any of our future webinars. And you will be receiving emails notifying you of future webinars. Have a good day, and once again, thank you very much for attending today's webinar.